51. Which of the following is the most effective way to prevent the spread of infections in healthcare settings? A. Using antibiotics for all patients. B. Standard precautions and proper hand hygiene. C. Limiting the number of staff in the facility. D. Isolating patients who are symptomatic. Answer: B. Standard precautions and proper hand hygiene. Rationale: standard precautions, including proper hand hygiene, are the most effective and comprehensive method to prevent the spread of infections in healthcare settings. Antibiotics should not be used indiscriminately, and isolation is important, but not a substitute for preventive measures. 52. Which personal protective equipment, PPE, should be worn when caring for a patient diagnosed with a viral infection spread by airborne transmission? A. Gloves and mask only. B. Gown, gloves, and N95 respirator. C. Gloves, mask, and face shield. D. Gown, gloves, surgical mask, and goggles. Answer: B. Gown, gloves, and N95 respirator. Rationale: airborne infections, such as tuberculosis, require an N95 respirator to protect against inhalation of fine particles. A gown and gloves are also necessary to protect against contact transmission. Surgical masks do not protect against airborne transmission. 53. What is the primary purpose of using contact precautions in infection control? A. To prevent the spread of infections through respiratory droplets. B. To prevent the spread of infections from contaminated surfaces or items. C. To prevent the spread of infections via direct air exposure. D. To prevent airborne diseases from spreading. Answer: B. To prevent the spread of infections from contaminated surfaces or items. Rationale: contact precautions are used to prevent the spread of infections that are transmitted by direct or indirect contact, such as MRSA or C. difficile. Droplet or airborne precautions are for other types of transmission. 54. Which of the following is the best practice for disinfecting patient care equipment that comes into contact with mucous membranes? A. Sterilization using an autoclave. B. Low-level disinfection. C. High-level disinfection. D. Wiping with alcohol-based hand rub. Answer: C. High-level disinfection. Rationale: equipment that comes into contact with mucous membranes must undergo high-level disinfection to eliminate harmful microorganisms. Sterilization is needed for items that come into contact with sterile tissue. 55. What is the purpose of a healthcare-associated infection (HAI) surveillance program? A. To monitor the use of antibiotics. B. To prevent the spread of infections within healthcare facilities. C. To isolate patients with contagious diseases. D. To report infections to public health authorities. Answer: B. To prevent the spread of infections within healthcare facilities. Rationale: HAI surveillance programs track infection rates within healthcare settings, identify outbreaks, and help prevent further transmission. While monitoring antibiotics and reporting to authorities are important, the primary goal is preventing infection spread. 56. When should hand hygiene be performed in a healthcare setting? A. Only before eating. B. After patient care and before touching any clean items. C. Only after performing medical procedures. D. Only when gloves are not worn. Answer: B. After patient care and before touching any clean items. Rationale: hand hygiene should be performed after patient contact and before touching clean items or other patients to reduce the risk of contamination. It is a critical practice to prevent the spread of infections. 57. Which type of isolation precautions should be implemented for a patient with suspected or confirmed influenza? A. Droplet precautions. B. Airborne precautions. C. Contact precautions. D. Standard precautions only. Answer: A. Droplet precautions. Rationale: influenza is transmitted by respiratory droplets, so droplet precautions, including mask use, are required. Airborne precautions are for diseases like tuberculosis, and contact precautions are for infections like MRSA. 58. How should a healthcare worker dispose of gloves after patient care? A. Dispose of gloves in a regular trash can. B. Remove gloves and place them in a biohazard waste container. C. Wash gloves with soap and water before removing them. D. Reuse gloves after disinfecting them. Answer: B. Remove gloves and place them in a biohazard waste container. Rationale: gloves should be disposed of in a biohazard waste container to prevent the spread of contaminants. They should never be reused or washed. 59. Which of the following is the most appropriate method for cleaning a surface that has been contaminated with blood or bodily fluids? A. Using an alcohol-based hand sanitizer. B. Using a chlorine bleach solution or an EPA-approved disinfectant. C. Wiping with a dry cloth. D. Spraying with water only. Answer: B. Using a chlorine bleach solution or an EPA-approved disinfectant. Rationale: blood and bodily fluids require high-level disinfection with chlorine bleach or other EPA-approved disinfectants to effectively kill pathogens. Alcohol-based hand sanitizer is not effective for cleaning surfaces. 60. Which of the following actions is necessary to prevent infection during the placement of an intravenous catheter? A. Cleaning the skin with soap and water. B. Using sterile technique and equipment. C. Performing the procedure without wearing gloves. D. Inserting the catheter without any antiseptic preparation. Answer: B. Using sterile technique and equipment. Rationale: to prevent infection, sterile technique must be used during the insertion of an catheter, including sterile gloves, antiseptic cleaning of the site, and sterile equipment. Soap and water are not sufficient for skin antisepsis in this case. 61. What is the primary role of personal protective equipment, PPE, in infection control? A. To prevent transmission of infectious agents between patients and staff. B. To make the healthcare environment look more sterile. C. To reduce the need for vaccination. D. To increase the speed of healthcare procedures. Answer: A. To prevent transmission of infectious agents between patients and staff. Rationale: PPE is used to protect both healthcare workers and patients from the spread of infectious agents. It includes gloves, masks, gowns, and other equipment. PPE is not intended to speed up procedures or replace vaccination. 62. Which of the following should be done before and after contact with a patient in a healthcare setting? A. Wearing gloves only. B. Performing hand hygiene. C. Using an alcohol-based hand rub only. D. Changing into a fresh gown. Answer: B. Performing hand hygiene. Rationale: hand hygiene before and after patient contact is crucial for preventing the spread of infections. Gloves and gowns are used as additional protection, but hand hygiene is the primary measure for infection control. 63. Which of the following infections requires contact precautions? A. Tuberculosis. B. Influenza. C. Clostridium difficile. C. Difficile. D. Measles. Answer: C. Clostridium difficile. C. Difficile. Rationale: C. Difficile is a healthcare-associated infection that is transmitted through contact with contaminated surfaces or items. Tuberculosis, influenza, and measles require different precautions, airborne or droplet. 64. What is the proper procedure for disposing of a used needle or a sharp object in a healthcare setting? A. Place it in a regular trash bin. B. Place it in a sharps container. C. Wash the needle with soap and water before disposal. D. Reuse the needle after sterilization. Answer: B. Place it in a sharps container. Rationale: used needles and sharp objects should be immediately disposed of in a designated sharps container to prevent injury and transmission of infectious agents. Reusing needles or placing them in regular trash is unsafe. 65. Which of the following is a correct application of standard precautions? A. Using gloves for all patient interactions. B. Wearing a mask for all patient interactions. C. Wearing gloves, a gown, and a mask for all patients. D. Using hand hygiene before and after patient contact. Answer: D. Using hand hygiene before and after patient contact. Rationale: standard precautions include hand hygiene, respiratory hygiene, and use of PPE when necessary. They are designed to prevent the transmission of infectious agents, not require the use of gloves and masks for every patient. 66. Which type of infection control measure is most appropriate for a patient with a diagnosis of active tuberculosis? A. Contact precautions. B. Airborne precautions. C. Droplet precautions. D. Standard precautions. Answer: B. Airborne precautions. Rationale: tuberculosis is transmitted through airborne particles, so airborne precautions, including the use of an N95 respirator, are essential to prevent the spread. 67. Which of the following statements is true regarding the use of alcohol-based hand rubs in infection control? A. They are effective against all types of pathogens. B. They are ineffective if hands are visibly soiled. C. They are recommended only for hand washing. D. They can replace the need for gloves in all situations. Answer: B. They are ineffective if hands are visibly soiled. Rationale: alcohol-based hand rubs are effective for reducing microbial load when hands are not visibly soiled. However, they are ineffective if hands are visibly dirty or contaminated with bodily fluids, in which case soap and water should be used. 68. What is the correct procedure for sterilizing reusable surgical instruments? A. Using a steam autoclave. B. Using a chemical disinfectant. C. Washing with soap and water. D. Using ultraviolet UV light. Answer: A. Using a steam autoclave. Rationale: the correct method for sterilizing surgical instruments is through steam autoclaving, which ensures the destruction of all microorganisms, including spores. Chemical disinfectants or UV light are not sufficient for sterilization. 69. What is the role of cohorting in infection control? A. To ensure patients are given the same medication. B. To group patients with similar infections together to reduce transmission. C. To reduce the need for sterilization of equipment. D. To separate staff and patients for privacy. Answer: B. To group patients with similar infections together to reduce transmission. Rationale: cohorting involves grouping patients with the same infection or similar infections to prevent cross-contamination and reduce the transmission of infectious agents. 70. Which of the following infection control strategies is most effective in preventing the spread of respiratory infections? A. Universal use of gloves by healthcare workers. B. Use of a surgical mask by patients and healthcare workers. C. Isolating all patients in private rooms. D. Limiting patient visitors. Answer: B. Use of a surgical mask by patients and healthcare workers. Rationale: surgical masks help prevent the transmission of respiratory infections by containing respiratory droplets. Isolation and visitor limitations can be helpful, but are not as effective in preventing the spread compared to mask use. 71. Which of the following is an example of a healthcare-associated infection, HAI? A. Influenza contracted from a community outbreak. B. A urinary tract infection acquired during hospitalization. C. A cold acquired from a family member. D. A rash caused by allergies. Answer: B. A urinary tract infection acquired during hospitalization. Rationale: HAIs are infections acquired in a healthcare setting, such as a hospital, clinic, or long-term care facility. A urinary tract infection from catheterization is a common HAI. 72. When should a healthcare worker change their gloves? A. Only after direct patient contact. B. After contact with a contaminated surface or body fluid. C. After performing hand hygiene. D. Only when gloves are visibly torn. Answer: B. After contact with a contaminated surface or body fluid. Rationale: gloves should be changed after contact with any contaminated surface, body fluid, or before moving from one patient to another to prevent cross-contamination. 73. What is the best practice for handling linen contaminated with bodily fluids? A. Fold the linen and place it in a regular laundry bin. B. Wear gloves and place it directly into a labeled biohazard bag. C. Shake out the linen and place it in the laundry. D. Wash it immediately without wearing gloves. Answer: B. Wear gloves and place it directly into a labeled biohazard bag. Rationale: Contaminated linen should be handled carefully using gloves and placed in a labeled biohazard bag to prevent the spread of pathogens. Shaking or washing without gloves increases the risk of exposure. 74. Which of the following is true about the use of personal protective equipment, PPE, during the care of a patient with suspected or confirmed Ebola virus disease? A. Only gloves are required. B. A gown, gloves, face shield, and mask are required. C. PPE is not necessary if the patient is stable. D. PPE should only be used when performing invasive procedures. Answer. B. A gown, gloves, face shield, and mask are required. Rationale. Ebola virus requires strict use of PPE, including a gown, gloves, face shield, and mask to protect healthcare workers from exposure to bodily fluids. PPE should be worn regardless of whether invasive procedures are performed. 75. What is the most effective method for preventing the transmission of respiratory infections in a hospital setting? A. Hand hygiene. B. Wearing a surgical mask only for patients. C. Regular environmental cleaning with disinfectants. D. Airborne isolation rooms for all patients. Answer. A. Hand hygiene. Rationale. Hand hygiene is the most effective method to prevent the transmission of respiratory infections in a hospital setting, as it reduces the spread of pathogens that can be transferred via hands. Masks, cleaning, and isolation rooms are supplementary measures. 76. What is the primary reason for performing disinfection of patient care equipment between uses? A. To ensure the equipment looks clean. B. To prevent the transmission of infectious microorganisms. C. To reduce the cost of medical supplies. D. To prevent the equipment from wearing out. Answer. B. To prevent the transmission of infectious microorganisms. Rationale. Disinfection is performed to eliminate or reduce harmful microorganisms from patient care equipment to prevent transmission of infections between patients. It is not performed to improve the appearance or to reduce supply costs. 77. In the case of a healthcare worker experiencing a needle stick injury, which of the following is the first step in management? A. Wash the area with soap and water immediately. B. Report the injury to the supervisor. C. Obtain a tetanus shot. D. Begin post-exposure prophylaxis with antibiotics. Answer. A. Wash the area with soap and water immediately. Rationale. The first step after a needle stick injury is to wash the affected area with soap and water immediately to reduce the risk of infection. Reporting and further medical intervention follow this. 78. How often should healthcare workers perform hand hygiene when caring for a patient in a hospital setting? A. Only before and after direct patient contact. B. Only after touching contaminated surfaces. C. Before and after every patient contact and after touching any potentially contaminated object. D. Hand hygiene is not necessary if gloves are worn. Answer. C. Before and after every patient contact and after touching any potentially contaminated object. Rationale. Healthcare workers should perform hand hygiene frequently, before and after any patient contact and after touching objects that may be contaminated, regardless of glove use. 79. What is the most appropriate infection control practice when managing a patient with a confirmed diagnosis of norovirus? A. Contact precautions and hand hygiene. B. Airborne precautions and hand hygiene. C. Droplet precautions and wearing a mask. D. Standard precautions without the need for PPE. Answer. A. Contact precautions and hand hygiene. Rationale. Norovirus is transmitted through direct contact and contaminated surfaces. Contact precautions, including gloves and gowns and frequent hand hygiene, are key to preventing its spread. 80. When should healthcare workers wear an N95 respirator? A. When caring for patients with tuberculosis or other airborne diseases. B. When treating patients with influenza. C. When handling blood and body fluids. D. When giving routine injections. Answer. A. When caring for patients with tuberculosis or other airborne diseases. Rationale. N95 respirators are required for airborne precautions, such as in the care of patients with tuberculosis, to protect against inhaling airborne pathogens. 81. What is the recommended method for cleaning and disinfecting a patient's bed rails after contact with blood or body fluids? A. Wipe with a damp cloth only. B. Use a hospital-approved disinfectant according to the manufacturer's instructions. C. Wash with soap and water only. D. Use alcohol wipes. Answer. B. Use a hospital-approved disinfectant according to the manufacturer's instructions. Rationale. Hospital-approved disinfectants are effective in eliminating pathogens from surfaces like bed rails. The manufacturer's instructions should always be followed to ensure proper disinfection. 82. Which of the following healthcare-associated infections, HAIs, is most commonly associated with the use of urinary catheters? A. Pneumonia. B. Urinary tract infections. C. Surgical site infections. D. Bloodstream infections. Answer. B. Urinary tract infections. Rationale. Urinary tract infections are a common HAI associated with the use of urinary catheters due to the direct pathway for bacteria to enter the urinary tract. 83. What is the recommended isolation procedure for a patient diagnosed with chickenpox, varicella? A. Standard precautions only. B. Droplet precautions. C. Contact precautions. D. Airborne precautions. Answer. D. Airborne precautions. Rationale. Chickenpox, varicella, is an airborne disease requiring airborne precautions, including the use of an N95 respirator to prevent transmission. 84. When should healthcare workers change their gloves? A. After every 30 minutes of patient care. B. When gloves are torn, visibly soiled, or after patient contact. C. Only after performing hand hygiene. D. Once every hour of patient care. Answer. B. When gloves are torn, visibly soiled, or after patient contact. Rationale. Gloves should be changed when they are compromised, visibly soiled, or after patient contact to prevent cross-contamination and infection. 85. Which of the following is an example of a critical item in infection control? A. A thermometer used for measuring temperature. B. A urinary catheter. C. A stethoscope. D. A blood pressure cuff. Answer. B. A urinary catheter. Rationale. Critical items, such as urinary catheters, come into direct contact with sterile body areas or the bloodstream. They must be properly sterilized to prevent infection. 86. What is the correct procedure for disinfecting a non-critical patient care item, such as a blood pressure cuff? A. Sterilize the item with steam autoclaving. B. Use an alcohol-based disinfectant. C. Use a high-level disinfectant. D. Discard the item after each use. Answer. B. Use an alcohol-based disinfectant. Rationale. Non-critical items like blood pressure cuffs should be disinfected with alcohol-based solutions or other appropriate disinfectants. Sterilization is not required for non-critical items. 87. How can healthcare workers prevent the transmission of methicillin-resistant Staphylococcus aureus, MRSA? A. By wearing gloves and gown for all patient interactions. B. By using alcohol-based hand rubs only. C. By practicing good hand hygiene and following contact precautions. D. By using only oral antibiotics for all patients. Answer. C. By practicing good hand hygiene and following contact precautions. Rationale. MRSA is spread through direct contact, so practicing hand hygiene and using contact precautions, e.g., gloves, gowns, can help prevent its transmission. 88. What is the correct procedure for sterilizing a surgical instrument that has come into contact with blood or body fluids? A. Use an autoclave to sterilize the instrument. B. Wipe the instrument with alcohol-based wipes. C. Wash the instrument with soap and water only. D. Use a chemical disinfectant. Answer. A. Use an autoclave to sterilize the instrument. Rationale. Surgical instruments that come into contact with blood or body fluids require sterilization in an autoclave to eliminate all microbial life. Disinfection or washing with soap and water is not sufficient for sterilization. 89. What should a healthcare worker do if they are unsure whether a surface is contaminated with a potentially infectious agent? A. Leave the surface untouched and continue working. B. Clean the surface with an appropriate disinfectant. C. Only clean it if it is visibly soiled. D. Report the uncertainty to a supervisor. Answer. B. Clean the surface with an appropriate disinfectant. Rationale. If there is uncertainty about contamination, the appropriate action is to clean the surface using a disinfectant to reduce the risk of infection transmission. 90. What type of isolation precautions should be used for a patient diagnosed with tuberculosis, TB? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions only. Answer. C. Airborne precautions. Rationale. Tuberculosis is transmitted through the air via droplets that can remain suspended in the air for prolonged periods, requiring airborne precautions, including an N95 respirator. 91. When is it appropriate for a healthcare worker to use alcohol-based hand sanitizers instead of soap and water? A. When hands are visibly soiled. B. When caring for patients with highly contagious infections. C. When soap and water are unavailable and hands are not visibly soiled. D. When handling food or drinks. Answer. C. When soap and water are unavailable and hands are not visibly soiled. Rationale. Alcohol-based hand sanitizers are effective in killing most germs when soap and water are unavailable and hands are not visibly soiled. Soap and water are preferred when hands are visibly dirty. 92. Which of the following is a key strategy in preventing the spread of antibiotic-resistant organisms? A. Restricting antibiotics to only critically ill patients. B. Avoiding the use of personal protective equipment, PPE. C. Ensuring proper hand hygiene and judicious use of antibiotics. D. Isolating all patients who are on antibiotics. Answer. C. Ensuring proper hand hygiene and judicious use of antibiotics. Rationale. Preventing antibiotic resistance involves both proper hand hygiene to prevent transmission and careful, appropriate use of antibiotics to prevent resistance from developing. 93. What is the most appropriate action when a healthcare worker observes a spill of body fluids on the floor? A. Ignore it since it is a minor spill. B. Immediately notify housekeeping and continue working. C. Clean the spill with a disinfectant immediately. D. Allow the spill to dry out on its own. Answer. C. Clean the spill with a disinfectant immediately. Rationale. Spills of body fluids can contain infectious agents, so they should be cleaned immediately with an appropriate disinfectant to reduce the risk of transmission. 94. What should a healthcare worker do if they are exposed to a patient's blood or body fluids through a needle stick injury? A. Immediately report the injury to the infection control team and follow the post-exposure protocol. B. Wait until the end of the shift to report the injury. C. Wash the site with soap and water and continue working. D. Document the injury in the patient's chart. Answer. A. Immediately report the injury to the infection control team and follow the post-exposure protocol. Rationale. Immediate reporting and following post-exposure protocols are essential to prevent the transmission of bloodborne pathogens. Delaying reporting can increase the risk of infection. 95. Which of the following best describes the role of personal protective equipment, PPE, in infection control? A. PPE is used solely for protecting the patient from infections. B. PPE is used to protect both the healthcare worker and the patient from the transmission of pathogens. C. PPE is optional and only used during invasive procedures. D. PPE is not necessary if the patient is known to be non-infectious. Answer. B. PPE is used to protect both the healthcare worker and the patient from the transmission of pathogens. Rationale. PPE is essential for protecting both healthcare workers and patients from infections by preventing the transmission of pathogens. It is not optional and should be used when indicated, regardless of the patient's infection status. 96. What is the recommended protocol for managing a healthcare worker exposed to a patient with Clostridium difficile, C. diff? A. Use gloves and gown when entering the room, and wash hands with soap and water after patient contact. B. Use gloves only, and wash hands with alcohol-based hand rubs. C. Use standard precautions without any additional PPE. D. No special precautions are required for C. diff. Answer. A. Use gloves and gown when entering the room, and wash hands with soap and water after patient contact. Rationale. C. Diff is transmitted through fecal-oral routes, so gloves and gowns are necessary. Soap and water are preferred for hand hygiene because alcohol-based hand sanitizers are ineffective against C. diff spores. 97. What is the proper technique for donning, putting on personal protective equipment, PPE, in a healthcare setting? A. Put on gloves first, then a gown, followed by a mask and goggles. B. Put on a gown first, then a mask, followed by goggles and gloves last. C. Put on a gown first, then gloves, followed by a mask and goggles last. D. Put on gloves and gown simultaneously, followed by a mask and goggles. Answer. B. Put on a gown first, then a mask, followed by goggles and gloves last. Rationale. The correct order for donning PPE is to first put on a gown, then a mask, followed by goggles or face shield, and finally gloves. This minimizes the risk of contamination. 98. When should a healthcare worker use contact precautions? A. When caring for patients with tuberculosis. B. When caring for patients with influenza. C. When caring for patients with a drug-resistant infection such as MRSA or C. diff. D. When caring for patients with respiratory infections. Answer. C. When caring for patients with a drug-resistant infection such as MRSA or C. diff. Rationale. Contact precautions are used to prevent the transmission of infections like MRSA, C. diff, or any infection spread through direct contact with patient or environmental surfaces. 99. What is the primary reason for the implementation of standard precautions in healthcare settings? A. To protect healthcare workers only. B. To prevent the spread of infectious agents from both symptomatic and asymptomatic patients. C. To reduce healthcare costs by limiting infections. D. To eliminate the need for hand hygiene. Answer. B. To prevent the spread of infectious agents from both symptomatic and asymptomatic patients. Rationale. Standard precautions are designed to prevent the transmission of infectious agents in healthcare settings, regardless of whether the patient shows symptoms. They apply to all patients, not just those known to be infectious. 100. What is the most effective method for reducing the risk of surgical site infections? A. Administering antibiotics before surgery. B. Using sterile instruments and maintaining a sterile field during surgery. C. Warming the patient prior to surgery. D. Using alcohol-based hand sanitizers in the operating room. Answer. B. Using sterile instruments and maintaining a sterile field during surgery. Rationale. The most effective way to reduce surgical site infections is to maintain a sterile field and use sterile instruments during surgery. Antibiotics may be used, but do not replace proper sterile techniques.